Good morning. Good morning, everyone. I think we should probably get started so that we keep in time and that everyone can make each session. Thank you for being here. Thank you for registering to come to our chat and our presentation. Um, this session is being recorded and also please make use of the chat function in the Q&A and also just to make any comments. And also thank you to everyone for introducing themselves and letting us know where you're joining from. My name is Musta. I use they, them pronouns. I am the Racial Justice Project Coordinator at National Ugly Mugs. And I'm presenting today alongside Rosie from Basis Yorkshire. And together we're going to talk about what it actually takes to build trust with people who have learned often from direct experience that being seen by services isn't always safe. So hidden our title is Hidden Identities, Hidden Needs. And I guess I wanted to explain like the framing of the title itself and what this means. So many of the people that homeless services support are navigating experiences that remain invisible to professionals. So sex work, insecure immigration status, substance use, experiences of exploitation, experiences of criminalisation, gender identity, histories of violence, or involvement with the criminal justice system. And these identities are often hidden because disclosure carries risk, not because these identities are identities that people are ashamed of. It's a calculated decision, a risk assessment. It's the fear of the risk of judgment. It's the fear of the risk of surveillance, the risk of losing housing, losing your benefits, losing your children, losing your immigration status, or losing access to services. And as frontline workers, you may never knowingly meet someone as a sex worker. That's what we heard in my project a lot, is that frontline services don't, they, sex workers present with the problem that they're coming to services with. So, instead of meeting someone as a sex worker, you might meet someone who needs housing, food support, mental health support, or crisis intervention. And I guess one of the key questions for today is what happens when the support system only sees the presenting need, but not the hidden realities. Okay, so next slide. So a little bit about National Ugly Mugs. That's the organisation that I am representing. So National Ugly Mugs is the UK's largest sex work led safety and support organisation. We support thousands of sex workers across the UK through a range of services. We have safety alerts, we have harm reporting, we have casework, we have mental health support, employability programs, and specialist advocacy. So National Ugly Mugs was originally established to improve safety by sharing information about dangerous individuals. But now it's a national organization that works across violence prevention, health inclusion, criminal justice, safeguarding, and policy change. So our work is rooted in like a simple key principle is that people are experts in their own lives, sex workers first, and rather than approaching sex workers solely through the lens of vulnerability or risk, we work from a rights-based and harm reduction perspective. And also, we recognize that sex workers are not a homogenous group. Nearly half of non-members are under 30. We have significant racialized refugee and migrant membership that creates different gender, sexuality, housing, economic circumstances. And over to Rosie.
And hi, lovely to meet everyone. Just a little bit about who we are as Basis, who I'm representing. Um, as an organisation, we support people who sell sex, people who are sex workers, people who experience sexual exploitation, both adult and young people. And this is through a wide range of different services, through everything from intensive casework support to light touch drop-in and outreach. We have housing first and wider housing support, support for domestic violence through IDVAs, support for sexual violence through ISVAs and specifically SWISVAs, so a sex worker independent sexual violence advisor. We're also really, really excited to be part of the IMSA Modern Slavery Advocate pilot as well. We also engage in influencing, communication, policy advocacy, and systems change across all of our services and for all of the people that we work with.
So, just a bit of context. Why are we talking about hidden needs, hidden identities, working to build trust with criminalised and stigmatized communities? We're talking about this, and we believe this conversation matters because homelessness does not occur in isolation, doesn't occur in a vacuum. Research consistently shows that people experiencing homelessness are more likely to experience multiple and overlapping forms of exclusion, including poor mental health, substance use, immigration precarity, poverty, racism, gender-based violence, and involvement with the criminal justice system, to name a few. The UK government's inclusion health framework identifies people experiencing homelessness, vulnerable migrants, sex workers, people leaving prison as groups experiencing some of the poorest health outcomes in this country. And Sex workers report widespread experiences of stigma and discrimination across housing, healthcare, policing, and support services. So when we're talking about criminalized and stigmatized groups, we're talking about people who are judged based on who they are, how they survive, and then they learn that being seen is dangerous. Homelessness services exist to reach people in crisis, as we all know, but if disclosure feels dangerous, then you're only really going to see part of that picture, and people will engage with you around the presenting issue while withholding the information that would actually allow you to support them better. And that is really a predictable response to risk. And what we need is to build trust through effective support. And really I also want to, I guess, define some two terms that we'll be using quite a lot, which is racialized, racialized people rather than using POC, people of color, BAME, black and minority ethnic. We use the term racialized because we recognize that race is a socially produced and socially constructed thing that operates through systems of power and systems of inequality rather than being an inherent characteristic of individuals. So I am racialized as black in this particular context, and the way that I might be racialized might shift in different societal contexts. So, also the key themes that we're going to be talking about are people hide their needs when disclosure feels risky, stigmatization and criminalization actively alienate people from services, and also trust is a precondition for everything. Those are the building blocks that we're really going to be working on. If we're taking apart trust, what does that look like? So a little background on the projects that this is drawing from. So the Racial Justice Project is a national research and advocacy program that is run by National Ugly Mugs and coordinated by myself. We have been running since 2021, and we are funded by Joseph Rowntree. The project centers the lived experience of racialized sex workers in order to identify the kinds of barriers that they face across key public sectors. And the research was really co-produced. It's really participatory at every stage. So racialized sex workers shaped our research questions. They continue to shape our research questions. They sit on our working group. They lead how our findings are disseminated and what our outputs look like. They have input on how, the policymakers and the service providers that we talk to. And we're currently in our second phase. And yeah, we've really worked hard to grow our working group. So now we have 32 paid members of our racial justice working group. And the project exists because racialized sex workers live at this intersection of really two compounding forms of marginalization, which is structural racism and sex work stigma. And really, very little of the UK's current support infrastructure is actually designed with this complex intersection in mind. So everything that I'm sharing today from the Racial Justice Project comes directly from people with lived experience of the systems that we'll be discussing.
And just a little bit about the SWISVA Partnership Project, which brings together Basis Yorkshire, National Ugly Mugs, and A Way Out. And this is around improving the services offered to sex workers who experience sexual violence and beyond. So it's not just the initial services that you might come into contact with or the specific sexual violence services, although those very much do form a part of it as well. So it's policing and criminal justice and potentially healthcare as well, but also the wider systems that sex workers will be encountering when they may also be dealing with the impact of sexual violence or potentially the causes of sexual violence as well. So that includes things like housing, broader healthcare systems, broader criminal justice systems, and any other services that they might be interacting with. The project includes building in frontline support in all three organisations in the form of a SWISVA, a sex worker independent sexual violence advocate, as well as community building and knowledge sharing among partner organisations, and as well in the broader sex work ecosystem and the sexual violence support ecosystem. So we run multiple forums for professionals who work with sex workers in sexual violence contexts to share good practice, knowledge, and resources, and ensuring that we can improve the learning of the community altogether so that sex workers are able to access appropriate support and informed support in whatever services they might be accessing, whether that's a specialist service, whether it's a worker in like a single worker in a broader, more generalist service, whoever that might be, making sure that we all have the knowledge and skills necessary and to try and change the systems to ensure that people have access to the support that they need. Next slide, please, Musta. So this is essentially just to get us all on the same page, and talk a little bit about what sex work is. It's huge, it's diverse, it's varied. Most of the different types are covered on what you can see on the screen, and these types are adapted from a piece of research that was commissioned in 2019 by the Home Office. Generally, you can break types of sex work down into three different categories: indoor, on street, and online, but these are not mutually exclusive categories, and people may well be working in one or more of the different forms, or potentially using different forms in different ways. This is also absolutely not an exhaustive slide. Sex workers are often engaged in multiple forms of sex work and will move between them as circumstances change. It's very hard to know exactly how many sex workers there are in the UK, and this is primarily due to the stigma that surrounds it. The vast majority of research estimates tend to be around about 70 to 100,000, but coming up with a clearer number than that is very, very challenging. And a very, very small proportion of the sex work that takes place in the UK is street-based. Again, estimated by most sources to be around about 3 to 5%, but they are often the most visible form of sex work. They often have the highest support needs, the highest levels of stigma and criminalisation and exclusion. Just in terms of the laws that sex workers are working under, it's a devolved issue in the UK. At the moment, the laws in England and Wales and Scotland are broadly similar, but they're very, very different in Northern Ireland. The laws generally will affect people who sell sex, buy sex, and third parties. And Mutsa will go into a little bit more detail about this later, but ultimately we work in a partial criminalisation system, which means that the laws are very complex and there's a lot of legal grey areas where people are operating in. Some workers face higher burdens of criminalisation than others as well, and this is historically street and brothel workers, but increasingly we're starting to see criminalisation creep into online spaces as well. Next slide, please, Mitza. Just a little bit around sex work and sexual exploitation and trafficking as well. It's really important to note that sex work, sexual exploitation, and trafficking are distinct things, but they can co-occur. And I'm working with this definition that was created by the Adult Sexual Exploitation Partnership, which was developed both by specialist organizations working with sex workers and with people who experience sexual exploitation, and also with people who have experienced sex work and sexual exploitation as well. So they define adult sexual exploitation as a form of sexual abuse of people aged 18 or over, where an individual or group threaten, coerce, manipulate, or deceive the victim into sexual activity for the benefit of the perpetrator. Sexual activity does not always involve physical contact. It can also occur through the use of technology. It is distinguished from consensual sex work as the act of coercion, manipulation, and deceit removes the freedom of choice to consent. And as we've said, they can co-occur, and sex workers can experience sexual exploitation. They can revert in and out of sexual exploitation and sex work depending on their situation at any given time. But it's really important to consider the two as separate things because this creates different needs, different support needs, and different needs within legal systems and justice as well. Often you find that sex work, exploitation, and trafficking are conflated by laws, international agreements, and by the media as well. And what this generally tends to result in is a focus on enforcement and prosecution rather than the protection of human rights for everybody involved. We start to see migration and mobility and human movement viewed through criminalised lenses. And we see a weaponization of these ideas of vulnerability and victimhood and a need to rescue people, particularly people who might not necessarily need or want rescuing. There is a lack of respect for autonomy in these situations. We see an erasure of trafficking victims who are not cisgender women or girls, and also particularly people who experience trafficking outside of the sex industry. There's a big focus on sex trafficking, but a significantly smaller focus on areas where trafficking is actually more common, like agriculture or domestic labour. And we also in the UK use something called the STIM tool, the Sex Trafficking Identification Matrix, to detect trafficking victims by scanning online websites, which has a huge amount of problems to do with how it's been designed. And a lot of the things that have been used on that tool to identify or suggest that someone is being trafficked are very normal and legitimate sex worker marketing tools. And so what we end up seeing is an increase in surveillance and reduced trust in the police, an increased vulnerability to action from authorities, and a particular targeting of migrant sex workers. This results in restrictions on travel at international borders, laws being passed which harm sex workers either advertently or inadvertently, sex work remaining stigmatized, and genuine victims of trafficking side of selling sex. Because funding gets directed away both from genuine victims of trafficking and from sex worker-led organizations. So it ultimately leads to negative responses all around if we start conflating all of these things as the same thing. And Mutsa.
Thank you. I'm just going to quickly shut my door because it keeps slamming. Just give me 2 seconds. It's the wind. So this is about intersecting identities and also compounding barriers. So one of the strongest findings across the Racial Justice Project research, we have 5 policy briefing documents that are currently out, and I think they were published in 2025. For healthcare, housing, higher education, policing, and support services. We are also launching e-learning mid-July for those 5 prospective public services and professionals that work in those services. But one of the strongest findings across all of our research was that people rarely experience a single form of marginalization. Participants described navigating multiple systems simultaneously. So when we talk about the sex work community, there's no sex work community. There's sex work communities there, and inside that there are different demographics, there are different identities, there are intersecting identities too. So in our research, we spoke to participants who were sex workers, um, and who identified as migrants, who are refugees or asylum seekers, who are survivors of interpersonal violence, who were survivors of state violence, who were disabled or neurodiverse. 65% of the Racial Justice Project working group is disabled or neurodiverse. They are parents that have legitimate safeguarding concerns. They're students that fear morality clauses or eviction or being kicked off their courses. They are people who are experiencing housing insecurity and also sometimes people who use drugs. Often, these people can exist all at once. They can exist all in the same person, and the identities don't simply add together. They interact, they compound, and they build up. And like, for example, concerns about racism might shape someone's experience of healthcare, especially medical racism. Concerns about immigration enforcement might shape someone's willingness to engage with support services. And concerns about sex work stigma might shape whether someone discloses that information at all. And one of the racial justice project participants described this in one of our housing dialogue sessions, and they said that so many people fall through weird legislation cracks, and it's all a consequence of a messed up eligibility criteria. So what is often presented as a personal barrier is actually a structural barrier. So that's what we mean by these hidden identities. Again, not to reiterate, these are not identities that people are necessarily ashamed of. They are identities that people may have learned are unsafe to disclose, specifically to public services, to housing. Over to you,
A
Rosie.
little bit around what sex workers need from homelessness and housing services. Because as we've already established, sex workers are a hugely diverse population. And we're going to be talking about people from people who are street homeless or rough sleeping, all the way to people who may have tenancies and have properties, but might still experience issues either as a result of their sex working or simply just need advice and support from a service where they're not going to be judged. Um, However, for people who don't have access to safe and secure housing, accessing housing is always going to be the first need. Um, and I think we're going to keep coming back to this phrase, housing being safe and secure and meeting people's needs. So it's not just necessarily about um, any house, it's got to be the right house for them. If you have somebody who is disabled and struggles getting upstairs, there's no point putting them in a third floor flat where the lift doesn't work half the time. They need to be able to access their property safely. However, they also then may need support to maintain housing safety and security. One of the biggest things that we see at Basis is issues with cuckooing. So as much as it's fantastic when we get somebody into a property and that property is great for them, if they then start experiencing exploitation within that property, they may still need that ongoing support to maintain their safety and security and stability in the place where they're living. They might also need help with other housing issues. So, for example, if there are structural issues in the house, or things don't work, or there's black mold coming up everywhere, so many different issues that people might just need a little bit of support navigating the systems to figure out how to fix. Accessing other services that meet their needs. And again, this will depend very much on what services they're already accessing. People may come to housing from sex worker specialist services. We do a lot of that at Basis. And so they may already be getting their needs met elsewhere. However, if they're presenting at housing as a first point of contact, they may need referrals or support into other services, so potentially a healthcare service that is going to meet their needs. Ideally, all of these services would be sex worker friendly, non-judgmental, non-stigmatizing. However, that isn't necessarily always going to be the case. So it really does take this whole system approach. Some sex workers may need support for managing unconventional housing strategies. Sex for rent arrangements were really big in the news a couple of years ago. The Home Office were doing a lot of work on it. And when sex workers face so many barriers to accessing some form of safe and secure housing, they may well engage in things like sex for rent arrangements as it's a preferable option to otherwise being potentially street homeless or rough sleeping or insecurely housed. This doesn't necessarily mean these arrangements are good, but they are entered into in active choices because it's the best option available to them, because the entire system is not set up for them to navigate. They may need support accessing household goods if they haven't had access to these in the past. They might need support with finance and budgeting advice. They may need to obtain legal advice, particularly around issues relating to housing. So, for example, tenancy rights or information about the Renters' Rights Act, for example. And if they may also need support if they face discrimination or poor treatment from landlords or housing providers. For example, if a landlord finds out that a tenant is doing sex work and they then start trying to blackmail them, or to try and get them to sleep with them, or to try and evict them as a result of their sex work, what support might we need to provide there? Next slide, please, Mutza. So these are a few quotes I took from NUM's Racial Justice Project. A lot of the themes in these are universal. While they very much come from racialized sex workers, a lot of these issues that they're reporting are going to be experienced by sex workers from a wide variety of different backgrounds. And they really highlight a huge number of the issues that we see. Few places would accept me without a guarantor or any paperwork, which means that the landlord I've ended up with is really dodgy. There's a lot of mold that made me really sick, and I can't do anything about it because there's no one to turn to. Housing is really precarious. Services would say my lifestyle is too chaotic. I'd be in hostels and they would always chuck me out. We are really vulnerable. We don't necessarily have people who can support us, people who can vouch for us. We don't have 9-to-5s to be able to provide support for a renting arrangement. There's no one to give correct character references. And a lot of poverty on top of that as well. So again, real challenges accessing the sort of private renting system, particularly. And a sort of a final quote, you're just faced with so little choice. And all of these barriers are put up systemically to prevent sex workers from being able to access one of the most fundamental basics of keeping ourselves safe and healthy and secure and functional. And a lot of this comes down to stigma. So we will go on to the next slide, please, Nitsa. I'm starting this slide with a quote from Miranda Kane, who is a comedian and former sex worker. And she says, stigma is that little thing inside your head which says that we need to eradicate this. We need to save the women involved. No one can be doing this of their own choice. Stigma kills because it's that little thing inside an abuser's brain. They say to themselves, it doesn't matter what I do to her. I know that she is too afraid to go to the police in case of what they do to her instead, and they're right. And I think what I like about this quote is that it gets to grips with the systems of stigma and the different ways that it can manifest. Sometimes it can be through violence and abuse, and at other times it can be through paternalism, infantilization, denial of autonomy, this sort of a rescue complex or a savior complex. Stigma generally involves blaming, shaming, and status loss for the stigmatized person or group. And it's an interplay between law, policing, service provision, and society. Stigma creates harmful laws, policing practices, services, and then all of these then reinforce that stigma. One of the things with stigma that's really important to recognize is that the people who are in charge of making our laws and our policies and enacting our laws and policies are part of society as a whole. And if stigma against a certain group exists within society, then it will exist among those who hold that power within society. So that power is then able to reinforce the stigma and the marginalization and the discrimination. I've said on the slide that it is the root cause of violence against sex workers, which I am absolutely standing behind, but I'm not just thinking about interpersonal violence. I'm not just thinking about physical abuse or sexual abuse or anything like that, but I'm also thinking about what we call structural violence, which is the violence when a social structure or institution harms people by preventing them from meeting their basic needs or rights. Violence doesn't just happen when a sex worker is attacked. Violence also happens when a sex worker goes to the police and the police say that we don't care about what happened to you because you're a sex worker. It also happens when they go to a hospital to get treated and the nurse stigmatizes them with calling them stigmatizing names. It also happens when they try to get support from their parents and their parents have disowned them for whatever's happened. Stigma appears in a huge variety of forms and violence appears in a huge variety of forms. It's not just out and out hatred, but in other marginalizing practices, which we'll talk a little bit more about later. Next slide, please, Mutsa. I just also want to draw attention to what we call the hierarchy, which is a particular form of stigma that you may not have encountered before, but exists very strongly within sex worker spaces and within society as a whole. And I'm going to read a little quote from Tilly Lawless, who is a trans sex worker, who says, "The hierarchy is the hierarchy that shouldn't, but does exist in the sex industry. Non-sex workers will view certain workers as dirtier, more disposable, or less worthy of respect than others. And sex workers themselves will often throw other workers under the bus in order to distance themselves from them and make them seem more respectable. It's driven by assumptions and prejudice. While you will find people of all different races, backgrounds, and genders in all different kinds of jobs within the sex industry, racist and classist assumptions feed into the hierarchy. Often, the most marginalized people will be forced to work on the lower rungs. For example, trans women of color often won't be hired in brothels, so have to do street-based sex work. So this hierarchy of sex workers is perpetuated by society and within the sex work community. And there's no clear consensus necessarily on the order that different forms of sex work or different types of sex workers would fall within the hierarchy. But generally, it incorporates both the sorts of sex work that someone does and a person's proximity to conventional standards of desirability and distance from criminalisation. So that includes gender identity, race, migration status, body type, disability, and more. So as you go higher up the hierarchy, you tend to find forms of sex work with less physical contact with fewer clients, less legal regulation, lower criminalisation, reduced risks of interpersonal violence, and a higher barrier to entry. So a potential need to have more resources in place to be able to start that form of sex work. So this may well include sex workers like pro-doms or content creators or sugar babies. Lower down the hierarchy, you have the people at the other end who face these higher burdens, which may include on-street sex workers, brothel workers, or escorts. Forms of sex work higher up the hierarchy experience relative greater levels of respect, acceptance, and lower levels of stigma, but that's not to say that stigma does not exist against those groups. And it can also manifest as a lack of support entirely. A lot of resources and support is concentrated amongst sex workers at the lowest level of the hierarchy, which may be to do with increased need, but may also be to do with increased visibility and stigma. Next slide, please, Mutsa. So this is a little diagram that I've been playing with, essentially to talk about the way in which stigma is built upon the entire structure of our society, essentially. I call this the stigma tree. It's very much not exhaustive. I keep adding things to this, but it's all about the different ways in which systemic power imbalances build upon one another and create the different forms of stigma and the different ways that stigma manifests when we start to see it in the open. So when you have a society that is built upon racism, transphobia, patriarchy, classism, carcerality, queerphobia, ableism, xenophobia, and then those then start to build into the systems, and the systems are built from those perspectives, we start to see these aspects of structural violence, exclusion, criminalisation, stigma and stereotypes, moral panic, scapegoating, because people are not necessarily being able to people who are from stigmatized groups are not able to access power to be able to create the situations for their benefits. And so ultimately, that manifests as interpersonal harm and violence, media stigmatization, denial of services, shame, societal shame, everyday discrimination. This idea that people or people from these specific groups are a problem to be solved, deportations for migrant sex workers. Um, like I said, this is absolutely non-exhaustive. Also, the idea of outing and using outing sex workers as a weapon against them, to essentially try and make them experience all of these things for whatever reason that might be motivated by. Um, so yeah, ultimately, stigma is a system, and stigma grows and has its roots within all of these societal power dynamics and the systems that are built upon them. I'll hand back to Musta.
Thank you. Thank you very much, Rosie. So, we finished talking about stigma for now, but we're going to talk about the other like key part of this session title, which is criminalization. So criminalization is more than just criminal law. We want to get really specific about this because I think it's one of the most misunderstood parts of sex work support. And I also think that the misunderstandings have real consequences on how services respond and what the service approaches are as well. So let me just read what's on the screen first. So in the UK, criminalization refers to a partial legal model where the act of exchanging money for sex itself is legal, but almost all activities necessary to engage in sex work safely are illegal, such as soliciting, brothel keeping, and managing. Also, that is a really sex work specific definition, but then in the little notepad, I have a more general definition of what criminalization is. Refers to how certain acts, people, or groups are defined as criminal. And that's not just through the laws and the policing, but also through the social norms, also enforced through the kind of everyday stigma responses that Rosie showed, the outing, the othering, loss of agency, things like this, stereotypes. And it also reflects the power relations and can target marginalized populations enforcing social control. So, with racialized populations, we see it a lot. Racialized populations are simultaneously stigmatized and also criminalized by virtue of being racialized. I feel some black boys tend to be criminalized more. Black boys are 11 times more likely to be stopped and searched in London than their white counterparts. Just black boys just loitering in the street, just standing in a group in the street is an act that can become criminalized. The police will ask you, "What are you doing here?" and then move you on. Um, the same way that with this hostile environment, policies that the government have been implementing over the last 10 years, 15 years, we have seen the criminalization of certain groups of people, migrants, refugees, asylum seekers, and I guess what that really means if your entire identity is criminalized. So in England, Wales, and Scotland, the exchange for sex is legal. But that's kind of where the legal protection ends. So everything that you need to do the work safely is criminalized, and the legal definition of a brothel or brothel keeping doesn't require commercial activity at all. It can simply be triggered by two or more sex workers living in the same premises or traveling in the same vehicle for the purposes of sex work. So that means, I guess, in practical terms, that sex work is the only occupation in the UK that is fully legal if only carried out in isolation. Um, Additionally, governance and regulation of online platforms and those who work on them is also mandated and enforced by extra legal bodies, including arm's length bodies, payment processors, banking systems, the actual platforms themselves. And that makes this work inaccessible for many sex worker demographics who might want to see fewer clients and have less physical contact. So, we're thinking about what it takes to do this work safely. Working with others is a legal risk. Living with another sex worker for safety reasons is a legal risk. And that's what Rosie was saying when she was saying this is a partial criminalisation model. It pushes people towards isolation precisely when togetherness would protect them. And also, right now, the landscape is kind of shifting. There's a lot of legal discourse, political discourse. Scotland is currently debating its own legislative change, and England has seen proposals around a Nordic or demand side model. And that's a model that criminalizes the buyer rather than the seller. And that's a model that I believe Ireland have adopted, and it's a model that people in policy rooms tend to assume will make things safer, criminalizing the buyers and the clients rather than the workers themselves. But the evidence doesn't support that at all. Sex work-led organizations across Europe have been doing research on this exact issue and consistently report that demand side or Nordic model criminalization drives sex workers underground because the clients fear being detected now by the state. So now you're working in more clandestine ways. It increases the pressure to accept dangerous clients as well. And it also reduces the ability to screen clients because clients don't want to be detected. So all of that is to kind of my point with that is that legal reform has to be led by the people that are the most affected by the issue, and not decided for them. At National Ugly Mugs, we say no research about us without us, and yeah, I really think that's important. But there's also like specific interactions with immigration law that is critical for migrant sex workers. So, under the legal model that we operate in, immigration status can affect what legal protection someone can access, and contact with police, contact with public services carries a risk of reporting to the Home Office, particularly under these hostile environment policies that I was talking about. And it also, I guess, it creates a situation where migrant sex workers face criminalization on two fronts simultaneously, as I was saying, criminalized for their sex work identity, criminalized for their migrant identity. And one participant in the Racial Justice Project in the housing policy briefing document highlighted that the knock-on effects far beyond policing. So in housing, sex workers have reported hiding their work from landlords, hiding their work from housing providers and support services. One participant told us there's no way I'm going to put on a housing application. I'm a sex worker. And another one said it's impossible to get a house unless I lie. And yeah, these are so when we talk about criminalization, I just want you to hold on to the fact that it's not just about when the police get involved. It's not just about legal enforcement and intervention. It's a structural force and it affects housing decisions, safeguarding, and whether someone feels able to tell a frontline worker the truth about their life. So, Rosie inspired me to no end with the stigma tree, and made me develop a concept to really illustrate carcerality and what is a carceral response. So, a carceral response is basically a prison crime and punishment approach. It's a response that prioritizes policing, surveillance, monitoring, enforcement, and punishment over support and autonomy. And it's also not always obvious when a service is doing this, especially a housing service, especially like supported living places that have, really specific procedures, escalation procedures. But that's where carcerality, unfortunately, can unintentionally arrive dressed up as care. And when we look at the visible layer of the iceberg, these are the things that show up in day-to-day practice. And it really summed up by compliance monitoring, mandatory reporting, information sharing without transparency, conditional access requirements, referrals to to enforcement agencies, and service exclusions, exclusion for non-engagement, excessive risk assessments, readiness assessments. This person is not ready to move on because they're still engaging in sex work. Gatekeeping, that's gatekeeping. And conditional access. Sorry, we cannot allow you to access our services unless you have exited sex work, unless you are no longer taking drugs. That's called conditional access. And it's a response that really prioritizes kind of compliance, monitoring, and conditional access. So, and what I really want to sit with is framing people as hard to reach rather than framing services as inaccessible. The single reframe, putting the difficulty on the person rather than the system, creates enormous damages. And below ground are the beliefs and systems that make these responses feel normal. Respectability politics, racism, classism, criminalisation, hostile environment policies, like I was just saying, distrust of marginalised communities, assumptions about what deservingness looks like. Someone who's if you are not willing to or not able, sometimes people are not able to stop sex working and are not able to access housing services because of that, and are then being seen as you don't need the help. You're not deserving of the help. And the roots are Oh, and then also exclusion from lived experience, exclusion of lived experience from power and policy making, from leadership. And these roots are often invisible in the room, but they are exactly what produces these visible behaviors above ground. I find this framework really useful because it moves beyond these individual intentions and it asks if the system itself is reproducing harm and how is it doing that, and also are our aims and goals aligned, our aims and methods aligned. And I'm sharing this module because I think it's a great diagnostic tool. And when you notice a carceral response or a pattern showing up in your service, like a compliance check, a readiness assessment that feels unnecessary, an exclusion policy that feels really unnecessary, then it's worth asking just what is the root growing from. Yeah. So the next slide, okay. The next slide is about how stigma manifests in service delivery. So in the middle, we have stigma, and then all of the kind of different manifestations. So when people hear the word stigma, they often think about the individual prejudice or interpersonal stuff. So they think about judgmental comments, raised eyebrows, exclusion, that kind of thing. But stigma also operates institutionally and it becomes embedded in practices, procedures, policies, eligibility criteria, and also organizational culture without anyone consciously deciding to put it there. And participants describe stigma appearing through assumptions, moral judgments, different treatment, being disbelieved, excessive scrutiny, gatekeeping, those readiness assessments, pathologizing language, unnecessary criminal justice involvement, and then also having your needs interpreted through stereotypes or through cliches. And yeah, one of our project participants, the Racial Justice Project, said that policy ought to be written outside of moral judgments, which automatically create barriers in terms of the kind of help that is needed. Even well-intentioned services can unintentionally reproduce exclusion, reproduce stigma, reproduce harm, especially once it becomes embedded in organizational practice. So these are also quotes from the Racial Justice Project. This is from a roundtable we held in March called "Racialized Sex Workers Speak Back," and that was as a response to the five focus groups that we did with public sectors, housing, higher education, healthcare, policing, and support services. And then we always like for our co-production working group to have the last word. So we had a roundtable to respond to the to what services had said. So one participant, Nomsa, said, described overhearing a manager at a supported living service explain why they couldn't house someone. And they said, we're a Christian organization. We can't accept someone who is sex working because it's not aligned with the values of the org. And Nomsa's response really stuck with me because she said, I thought the values of the org were people have support needs. We're going to provide you housing related support. And I really think that encapsulates the gap in just one exchange, that the value statement actually excludes the very people that the service exists to support in the first place. And Julian, another participant, who is currently doing some great activist work, calling for the women's census to start collecting data on how many homeless women need sex work specific support. But Julian called out something and he said the homelessness sector needs to speak to sex work groups, not just VOG groups, violence against women and girl groups. Uh, Survival sex and sex for rent arrangements don't often get named as sex work at all in homelessness contexts, which means that the specific support, the harm reduction information, and all of the framing, all of the research that we're doing as sex work organizations and that we've developed never actually reaches the people that need it because there's a gap there. Kiara put it plainly, we're seeing really high rates of rehomelessness because the housing sector doesn't see us as deserving. And Sabrina's words are the ones that I guess I want you to hold on to a little bit is that they need to have a more neutral perspective that doesn't cast moral judgments on what the work is. People are having transactional sex, and sometimes they're not being paid in money. They might be exchanging that for housing or shelter or drugs. There is too much sanitization going on in the way that people understand our struggles. Many of our participants felt like they were viewed primarily through stereotypes and primarily through discourse narratives rather than as individuals and individuals with really complex lives. And also for racialized sex workers, this sex work stigma often intersected with racism, migration status, language barriers, and assumption about culture. So basically, sex workers just want to be approached with curiosity rather than judgment, but not voyeurism. Back over
Just
to you,
going
Rosie.
to go for this slide very, very quickly just for time because we've got some great stuff at the end that we want to get to. So just a slide that hopefully you can all come back to if you have a look at the recording, looking at barriers to accessing services. Some barriers are individual, due to a person's circumstances, due to what support they have available to them at any given time and what they don't have available to them. Some are to do with service characteristics, so how a service presents themselves, how you can access that support, what time of day the support is offered, for example, or the potential conditionality of support. It's also really important to note that sex workers talk to each other. If someone has a good or bad experience with a service, they will go and tell their friends about how great or not great your service was. So it's both a really key way to unlock trust in the community and also a really easy way to lose it as well. And then there's structural barriers as well. All of these facets of stigma and criminalisation and carcerality that we've spoken about. But the other one I want to focus on is service funding, because another group of people who have power are the people who fund all of the services that we all run and that we all come from. And so there's also work to be done on that front, getting them to recognize what sex workers' needs are and to work with them in a non-stigmatizing way as well. Because otherwise, all the money is going to get directed again towards these sort of rescue projects and sort of exit-focused organizations, and that's it then going to trickle down into what's available for sex workers. So there's also advocacy to be done on making our funders and commissioners also aware that the most positive approach to working with sex workers is a rights-based and a harm reduction approach. I will leave that slide there.
Okay, back to me. Just to talk briefly about trust and disclosure. I've described disclosure as this really conscious risk assessment that stigmatized and criminalized people are doing. And before disclosing their hidden identity, their hidden need, they're running this assessment often instantly, and they're asking, "Am I safe here? Will I be believed? Will I be judged? Who will know? What happens if I tell the truth? Will this help me or make things worse? And also, do I have control over what happens next?" But this also extends to whether staff can be trusted, how their information is used, who their information is shared with, whether confidentiality will be respected, whether disclosure will affect their housing rights, their immigration status, or their support, whether they'll be judged, and then whether disclosure will actually improve their outcomes. Um, and one participant, Julian again, he described something that I think is really important when working in housing specifically. And it is the fact that sex workers are literally committing fraud just to meet eligibility and access housing. And it's something that he said, we don't want to do this. This is like they force us to have so many paper trails, this forced financial transparency because the state wants to know where and how money is moving every day, every second. Julian went on to point out that 50 years ago, sex workers could just earn money and not have to account for its origin in the way that the current system now demands. And that basically just illustrating the direct consequence of increased financial surveillance and how that collides with criminalized income, and how sex workers are constantly navigating the criminalized income, even if sex workers pass affordability checks for a house, the income is still criminalized. And Another participant summed up the disclosure with there's no incentive to disclose. You slap the label on yourself and you're welcoming in the stigma, the paranoia, the coming out, all of that. That's all you gain from putting your hands up right now. And like, if your service genuinely wants disclosure, I really don't want us to leave this session with the takeaway being, how do we get people to tell us their hidden identities and hidden needs? It's like, what would make telling us safe enough to be worth it? Like, how can we make it worth it? How can we make it safe? And then this goes on to the building trust. Oh no, it doesn't. It goes on to back to
No,
Rosie.
could we skip to building trust so that we can get
Okay, let's skip to
our
building
top tips
trust.
for going forwards?
Yeah, let's skip to building trust.
And after that,
But we will be
there you
sharing
go.
slides, so these have like some good research and report links and things like that. So building trust. So participants were remarkably consistent about what builds trust over the 4 or 5 years that we've been doing the Racial Justice Project research. Is that sex workers want transparency, consistency, respect, accountability, clear confidentiality policies, non-judgmental communication, staff that really understand their experiences, and then meaningful involvement in service design. And one finding like stood out for me is that in our most recent healthcare survey, 95% of respondents said that they would be more likely to access a service if it employed staff with lived experience. And that shows that trust grows when sex workers are treated as experts in their own lives, treated as partners in how a service is designed, delivered, and led, and moved from this historic research position of being subjects, research subjects, or being victims that need to be rescued, or risks that need to be managed. And this really, we're not talking about. It would be great to have more housing options, more beds, more outreach hours, but trust also requires this system change, the embedding, inclusion, anti-racism, and peer leadership into housing policy itself. And then this leads me to, so this is part of the a synthesis report. We've been part of the UK Health Security Agency's Inclusion Health Network, that has people with lived experience on it, that has organisations that are peer led on it, and really working to talk about how to do co-production well, and also what commissioners might look for as well. So this was also part of the work that National Ugly Mugs did with the UK HSA. It was one of our little visual note taking, and building trust at scale really means embedding this lived experience knowledge directly into how your organization works. It doesn't mean just consulting it occasionally. It means fully embedding it. It means thinking seriously about your board, thinking about your staff members, thinking about your volunteers, how you consult service users, how you consult community members. Are they being compensated? Is it just a box ticking exercise? Is it ongoing practice? Is it a hit and run research? Like, we want it to be long term, embedded, and really actively challenging stigmatizing policies where you can find them, rather than waiting for your lived experience staff to come and complain about something. And one of the clearest demands across all five reports was this co-production, is that we don't want tokenistic engagement, genuine involvement in shaping services. So yeah, participants repeatedly called for peer leadership, paid lived experience roles, better representation in decision making, involvement in training development, and then also involvement in policy design as well, because the people closest to the problem are often the people who know the solution, the closest to the solution. Um, yeah, let me just move on for time. So these are the I want to close my little section talking about the key tenets of harm reduction. These really they underpin the Racial Justice Project's work. And I think it also reframes kind of the central question that everything else has been asking today. And like, harm reduction doesn't just ask how do we stop this behavior, but how do we increase safety, dignity, autonomy, and access to support right now as the person's situation actually is. And we've identified five key tenets from our learnings, which is meet people where they are right now, not where you prefer them to be. If someone cannot exit sex work, they're doing survival sex work and they need the money to survive, you need to meet them where they are, not where you want them to be, not where you're not where compliance checks would force them to be. Similarly, with people who are using substances, please meet them where they are. And the second one is recognizing people's agency. Every single person has a right to make informed decisions, and without constrained circumstances. Making decisions within constrained circumstances is just conditional compliance, and it's not the same as having judgment, having agency. The third thing is reducing barriers to support. Every additional condition is a chance for someone to opt out, is a chance for someone to exit services and to be disengaged and to never enter re-engagement. Um, and these are often people that need it the most, the people that are the most at risk of social and structural exclusion, and isolation as well. Um, the fourth one is avoiding conditional access. Don't make support contingent on disclosure, compliance, or readiness. And then the fifth one is prioritizing safety over compliance. Safety safety is the outcome that matters for housing providers. Safe, secure, and meets people's needs, like Rosie said. Compliance is just one possible route to that. And it's also not, it's often not the most effective route. So if you take everything from what we've shared today, I just want it to be that the communities most affected by stigma and criminalisation are actually not hard to reach. They're actively making rational decisions and rational risk assessments about who they can afford to trust. And what our collective responsibility is, as people who work in service of them, is to become worthy of that trust. And I want to hand it back to Rosie.
Thank you very much, Mutsa. So just talking a little bit about some of the things that you might want to consider sort of across your organizations when you're wanting to build that trust. So the first bit of this is signaling safety. Think about some of the barriers that people might face accessing your service and how you can potentially mitigate these. You might want to think about practical aspects, such as where your service is based, how people can get there, the times that your service operates. There's no point having mandatory appointments at 2 o'clock in the afternoon if someone's been out working all night and needs to sleep during the day. Language barriers for migrant workers, people who are speaking English as their second, third, or fourth language, but also the institutional barriers that might exist. So, a need to build trust with people. Language use, ensuring that across your materials and any interactions you have with people, that your language is non-stigmatizing. Obviously, we like the term sex work. That's the perspective we come from. However, if you want a more neutral term, I quite like people who sell sex or people selling sex, which doesn't come with some of the more loaded stigma that exists with other language around sex work. Think about what images you use on your marketing materials. Who are you representing, and are they actually representative of the people who use your service? That's not to say you need to actually use people who access your service as people on your images, but if you are claiming to be an all gender service, but your marketing and outreach materials only show white cis women, are people seeing themselves reflected in those materials? Are they seeing that it's a service for them? You might want to collaborate with other trusted sex worker organizations to share information and access knowledge and resources. For example, if you have an organization in your area that sex workers already trust and access, could you run a joint outreach with them, or leave leaflets in their service, or attend drop-ins that they run, and explore how you can share information with one another to reach sex workers? You can use some subtle signals to suggest that your service is sex worker friendly. So, sharing that your service is connected to sex worker friendly organizations, saying that you're a member of National Ugly Mugs, or using red umbrella pin badges or little symbols on your websites, which is generally regarded as the symbol of the sex worker rights movement. Thinking about intersectional accessibility. What wider barriers might people face accessing your service, and how could you mitigate these? So, for example, if you have a client who is neurodivergent, but your space is full of bright lights and loud noises and busy and really challenging for them to access, how could you make it so that they then feel not just included as a sex worker, but as a neurodivergent person within your service? And also, how politically outspoken can you be, or how open can you be about sex work related issues on a local and national level? How can you challenge practice? Can you submit to a consultation? Can you share a post on Instagram for International Day to End Violence Against Sex Workers? Showing that you're engaged with community issues and that you understand the community can also be a really positive way of signaling that you understand a community and that the organisation is safe for them. Next slide, please. Mutz has already spoken a little bit about embedding knowledge, having people who are sex workers or from other marginalised communities as members of your board, staff, volunteers, and as your service users and through community consultation. You can potentially use ongoing surveys or other research to understand the needs and developing needs of a particular community. And I know there are some organisations, I know MASH in Manchester is one, who have a sort of longer term, sort of lived experience steering group, sort of similar to a board of trustees, but made of people who use their service to steer and shape their organisation. Really importantly, ensuring that people are compensated fairly for their time and knowledge and engagement. Within your organization, fostering a culture which promotes inclusivity, diversity, and support for all of your employees, and challenging stigmatizing practices within your organization, such as colleagues using poor or stigmatizing language, or policies which would prevent sex workers from being open about their experiences. There are some organizations which still will fire people if they know that they have done sex work or are continuing to do sex work alongside being employed there. And not only does that make it hard for you to have lived experience people as members of staff on your organization, but it also means that sex workers aren't going to trust you because they still think that you see sex work as a bad or negative thing, and you're still reinforcing that stigma. You might want to explicitly invite people who are sex work experienced to apply on job adverts as part of your broader inclusion statements, and also not automatically excluding people who have convictions shown on DBS certificates, and making this really clear to applicants during your hiring process. Saying that, yes, we may need a DBS check, but we're not automatically going to exclude anyone who has things show up on it. Not just hiring in lived experience roles, but across your organization. Be really careful that including lived experience doesn't lead to these are the regular staff and these are the lived experience staff. There's a really good report by an organization called Groundswell on this. Um, Considering intersectionality, people who sex work will, as we've said throughout the presentation, will face other barriers. They might be disabled, they might have caregiving responsibilities, they might have barriers around their migration status or trans identity, for example. So what else needs to be put in place for people with these identities also? So things like flexible working for carers, trans inclusion training, or a neurodivergent friendly culture. And also, if a person has recently left sex work, what other support might they need to adjust to a more mainstream job? So, support on budgeting or an advance payment for transport. And final section, please, Mitza. Finally, these non-othering approaches. The balance between recognizing the unique needs and experiences while also ensuring that the support is non-exceptionalizing as far as possible, ending stigmatizing policies and practices within your organizational culture, and working with an individual's presenting needs. What are they telling you, and what support are they requesting? Not making assumptions, but ensuring that you're working with a person with what they're asking for. A really good question to ask is, would I do this if they weren't a sex worker? And there are times when you may have to do things that are exceptional for sex workers. And if that's the case, explain why. How is this going to benefit the support that you can give someone? So, for example, if you're working in a healthcare setting and you're asking, are you sleeping with people who take drugs or are men who have sex with men? That might seem quite an invasive question, but actually, if you say, I need to know this question because I can then get you access to particular vaccines, it explains why. It shows that you're understanding those particular needs and that you're being responsive to those needs rather than asking a question out of invasiveness, curiosity, or stigma. And on to our conclusions.
I don't know if we talked about how to divvy this up, but these are the
We did not.
conclusions. I'll do this one. So people hide their needs when disclosure feels risky. This is, like I said, this is the risk assessment that criminalized and stigmatized groups are doing before disclosing, and these are weighed up, um, you know, due to the stereotypes, due to the approaches, due to the service design, and also just the kind of language that people are using, the kinds of messaging. And stigma and criminalization alienate people from services. They also alienate the people who are already the most alienated and excluded from services. The people that don't want to be detected, the people that fear detection, the people that fear accessing public services, that fear accessing anything that has to do with the state. Migrants, refugees, asylum seekers, sex workers, and then trust as a precondition for everything. Trust is these building blocks. And also, well, there are building blocks that make up trust. in a variety of ways and requires whole systems approach and is not a fast or easy a process. Reflect on how stigma and power manifest in practice and how we can work to dismantle these.
No, we're a little over time, but we do have some questions in the Q&A. I'm happy to stick on and answer some of those if
Same here.
people want to. Though obviously this is the end of the time that we have for the session. So thank you all so much for being here if you do need to go. It's been wonderful. Thank you for being
Thank
so
you so
engaged and
much.
lovely.
Thank you.
But shall we have a look at some of these questions, Mutsa?
Yeah, I would really like to answer Hazel's question about it feels vital to highlight the need for trauma-informed approaches here alongside
Yes.
non-stigmatizing. I totally agree. I totally agree, Hazel. But it's interesting when we were developing this presentation, we talked about trauma informed as a kind of buzzword that's sometimes used, but when no one is conceptualizing what that means. What does trauma
Mm,
informed mean? What does trauma informed mean for people that have not only experienced interpersonal violence, but violence at the hands of the state? And what violence at the hands of public services, harm, what does that look like? So we really tried to break this down into what we thought the kind of key tenets of trauma informed were: the trust, the harm reduction, inclusivity, transparency, um, meaningful involvement with communities and peer-led groups. So yeah, I feel like working in a trauma-informed way is being promoted. I feel like it's being promoted, but I wish we could all conceptualize what that really means. Like let's really understand what that trauma what we're referring to there.
yeah, I also wanted to jump in on that one as well, because it reminded me of a post that a friend of mine made fairly recently on LinkedIn. And this is someone who is very open about being lived experience and is also now working in the public health sector. And she said, "Does anyone else wince when they hear the term trauma informed these days? It's one of the many buzzwords that I hate and has grown to become meaningless. I see organizations that proclaim to be leaders of such frameworks become increasingly hostile and practice defensively when challenged. If anything, I now start to feel put off when someone describes themselves as trauma informed because it's become so misused as a term." So I know as well, I've seen people start to use the phrase trauma responsive as well, rather than trauma informed, which I am interested in exploring a bit more. I've not quite dug into that yet. But yeah, I think what Mutsa was saying, that it has become a little bit of a buzzword, but very much a lot of the things that I think we're talking about are key to a trauma-informed approach. So it is just breaking down what actually does trauma-informed mean and how do we put that into practice in the day-to-day running of our organizations.
Yeah. Jasmine has a really interesting one, kind of coming from a lived experience perspective. Jasmine says I had some training which said we should not refer to groups of sex workers as the girls.
Mm,
Jasmine completely understands why, because it infers underage or young girls, but they spent 12 years operating in the sex industry. It's a very common phrase used amongst sex workers to describe themselves and their comrades. And Jasmine finds it really difficult to separate from that part of their identity and change the language to fit professionals' view on things. Wondered what advice there is about that. For me, it's about really understanding how you interact with this insider outsider status, and thinking about I guess what professionalism looks like in this insider outsider status, because you while while you may have had insider status by virtue of operating in the sex industry, you might have outsider status now in that you are part of a service or a public service. And I'm constantly navigating this as someone who used to do sex work, as someone who does research on sex work, as someone who is like, it's a really difficult one to navigate. But I would just say, listen first, talk to the group that you're interacting with. How do they want to be referred to? And just
mm.
just go from listening first, and yeah, not trying to shoehorn our own preconceived notions and stuff.
Yeah, very, very similar advice to what Mutsa was saying as well. And I think it's very much going to depend on what context you're speaking in. If you're talking to other sex workers, absolutely fine. If it's the language that other sex workers are using to you about themselves, also absolutely fine. But if you're going into spaces where using that language might come with some of those that greater baggage, like you said, the inferring underage or young, or just the general infantilizing nature of it. If you're going to be talking to other professionals, to police, to other services, that's when I would be really careful about it, because it then reinforces those more stigmatizing connotations and those challenging conversations around it. It's being read very differently in different contexts. It's like it's different when you're out with a group of female friends and they are the girls to you versus when men are talking about men and girls, for example. They have different connotations. So yeah, I'd say there's definitely times when it makes sense to use it, and there are definitely times when I would be more cautious about using it as terminology.
Yeah, yeah, absolutely. Nick has not a question, but really important. The Frontline Network Training Fund can provide grants up to £500 for individuals and £1,500 for groups to support skills development for frontline staff. And yeah, you can find it in the funding and training fund section of Frontline Network's website, which is, yeah, really great. The first question from Bidwell was thinking about the themes from your discussion. What training would be most helpful, and are there any gaps or areas you feel aren't currently being covered in the sector? So people that want training funding, Frontline Network, but for any gaps or areas that I feel are not currently being covered in the sector, I really feel like we need to have a conversation about harm reduction. As someone who has a history of working in supported living, yeah, I think having the conversation about meeting people where they are, not forcing compliance, not carcerality and harm reduction are two big things for me. Is not having these kinds of prison logics and crime and punishment logics in housing. It makes it really difficult, especially if people are fleeing like abusive relationships and stuff. It genuinely can make people want to go back. So yeah, just meeting people where they are and having compassion. I think that there needs to be more training on like really what that looks like in practice.
Mm. No, I think that's fantastic. And I think just again, greater understanding of the intersections of marginalized identities and having training as far as possible be delivered by people and organizations that come from lived experience perspectives, to get an understanding of it's really challenging because obviously every different sort of marginalized and intersecting identity is going to have different challenges, and they're going to become even more different when you start combining them into different human beings essentially with different life experiences. But at least as a good sort of understanding, groundwork and framing, training from trans people about supporting trans people, training from neurodivergent people about supporting neurodivergent people, training from sex workers about supporting sex workers. The difference between sex work, exploitation, and trafficking, we could do a whole day on it. It's huge and it's thorny, but there's so much to get into on that. But yeah, training from people with varying disabilities around their experiences accessing support, training from prison leavers and care leavers. There's so much there, but I think just really continuing professional development from people with a wide variety of lived experiences and centering those experiences. Um, I also really wanted to get into Jasmine's other question as well. There have been issues in the past. I don't know if it is still happening, but certain feminist groups were sending men into sex work establishments with hidden cameras and then sending the information to local councils. It was causing workers to go underground and also resulted in sex work establishments sacking workers who had been recorded. Yeah, that was a big thing. I remember that very vividly. And it's really very much that carceral response that I think Mutsa was talking about. And one thing that really gets me about that is, like you said, they were groups that considered themselves feminist. But I think as feminists, we can agree that filming women without their consent is a bad thing. Except they were going, oh, filming women without consent is bad, except when we do it. Um, so there really is this sort of almost this dehumanization of sex workers because it's like, well, we can do all these bad things. These are the women, well, not just women, women and people who can absorb society's ills, essentially. And again, we see that narrative play out over and over again in various forms of discussion. But the fact that they didn't consider sex workers as women or people enough to apply their own morality to it, I find really disgusting. And I think again just reinforces that all of those facets of stigma and carcerality that we've been talking about throughout the whole presentation. And yeah, I've not heard of it happening any time in the last couple of years, but if it
Yeah.
was still happening, I wouldn't be surprised.
Yeah, I think I think the reason it stopped happening was because they just started cracking down on um sex venues in general. And
Yeah.
but I believe what Jasmine's referring to was about like things that were happening in Bristol years ago. And but this led to basically these non-consensual images and videos being shared in court. And really being used to reproduce the narratives that sex work is inherently harmful to all women. There is no way you could ever make a choice to do this. And also, any of the harms that you face while doing sex work are inherently criminogenic, and it's kind of par for the course because you do a dangerous job. Which includes being recorded without your consent. Yeah, but I
Mm.
think there is a big thing to be said there about how the feminist groups or the Vogue groups often exist in a separate space from the sex work advocacy organizations and organizing. It's really tough because in we're aligned. We're aligned in our goals. We want to stop violence against women and girls. We really do. But we also want to do it in a way that recognizes that you have to meet people where they are, and not everyone can stop doing sex work, and some people need survival sex work in order to even stay alive and have a roof over their head and send their kids to school and stuff. So yeah, it's really complex and requires nuance that I think the feminist groups were not understanding. But thank you so much. I really appreciate all 37 people who have stayed on. Yeah, really great. And yeah, please contact us anytime. Again, like I said, Racial
Yeah.
Justice Project has e-learning. We have e-learning that is launching mid-July. Um, yeah, please email me. Yeah, I'll add you to a list or something. I don't know. Jasmine says it was Sheffield, but yeah, it was up and down the country at the time. But yeah, I
Yeah.
remember it happening in Bristol as well, and Leeds, I think. But thank you so much. I really appreciate it.
Yeah. Thank you for the great questions as well.
Yeah, really great questions.